my experience is an experience as a scientist, but also as a part of a policymaker environment, because apart from my affiliation with the IULM, I am currently affiliated with the Berkman Center for Internet and Society at Harvard University and with the OECD. At the same time, the project that I will discuss today is part of a big project with the Bruno Kessler Foundation in Italy, whose computational part will be illustrated and discussed tomorrow by my colleague Mario De Domenico. So what is our focus here is the socio-behavioral dimension, because sometimes we know there is a huge focus on protocols for public health prescriptions in the traditional sense, but as it comes to behavioral prescriptions or communication, often we don't have analogous solid basis for motivating and designing our interventions. So think of the COVID epidemics in particular, in a situation where, like in the present case, the next slide, please. The reliable therapeutic strategies are still missing or under construction. Of course, the behavioral dimension becomes the key variable. But the point is that, especially for this reason, misleading public perception on just, as we have seen previously in the previous talks, legitimizing wrong conceptual approaches to the epidemics can be extremely dangerous from a point of view of the public health consequences. So for this reason, the infodemic dimension is in some sense integral to a constructive approach to the pandemic. And so it's extremely important to develop an integrated perspective of public health itself, where the medical and social behavioral dimension are basically two sides of the same coin. And in particular, it's extremely important to evaluate the behavioral effects of public communication in this particular regard. Next, please. So we work on a computational social science approach, because in this case, of course, you can define and quantify specific social behavioral aspects of the infodemic. And in particular, it's very important to distinguish the emotional dimension with and the cognitive one, because of course, both concur to determine the final outcome, but they have different roles and they need different indicators. And it's extremely important to disentangle the two aspects in understanding what is the social process behind the infodemics. In particular, in our approach, we are focusing on already available indicators for especially for the emotional part. For example, the so-called VAD approach, valence arousal dominance approach, is today an approach that has been implemented successfully in terms of computational social science to extract the emotional dimension of, for example, social media communication. And at the same time, we are using also Big Five indicators in this particular case to define the mass psychology that is connected to these social dynamics. We understand that the Big Five today are probably not the gold standard in terms of indicators, but they are at the moment the easiest to implement, and they're probably a very good basis to start a mass psychology analysis of communication, where in the case of Big Five, having to do with personality traits, is not simply the emotional dimension, but is an interesting mix of the emotional and cognitive dimension. So, next please. In terms of, thank you. So in terms of collective sentiment and psychology, we can build dashboards, very simple dashboards that can be read in terms of the emotional impact and the emotional dynamics linked to certain types of communication. And in particular, when we are able to track sources that can be particularly critical in terms of reliability, we can analyze, for example, how they influence the collective mood and the collective dynamics, and we can decompose the specific signal in the various components. For example, from the point of view of valence arousal dominance, we can distinguish aspects that are particularly important. Valence has to do with the pleasantness of the stimulus, how pleasant it is. Arousal is more about intensity. Dominance is about feeling of control. Think, for example, what happens typically in infodemics is that people get very scared. Being scared is an emotion that has a very low dominance because people don't feel in control. So what they tend to do is they tend to acquire, for example, more control by shifting the frame in ways that they think can control. Think, for example, of the phase in which the COVID epidemic was initially compared to a sort of bad flu. Why this is, for example, easily understandable in the bad context? Because flu is something we are familiar with. So in the moment in which we reframe COVID as a bad flu, we feel more in control and we feel less scared. But the problem is that in this case, feeling more in control is at the cost of a totally wrong reframing of the actual dangerousness of this particular threat. So it's extremely important to understand and to track as the emotional modulation in the infosphere in this case, and how the infodemic is playing with this can influence behavior in ways that are particularly complicated and sometimes extremely dangerous. Okay, next please. The other aspect, next please, thank you. The other aspect is the cognitive one. So from this point of view, for example, we know that there are different types of incorrect or fake news, but clearly they have different potential in terms of harmfulness. Think, for example, of conspiracy theories. Why conspiracy theories are particularly dangerous? Because it's not simply exposing people to the wrong information, but it's about changing the way people interpret information. So in this case, you can not simply mislead people on one single choice, but you can systematically mislead people on every possible choice, and simply, in some cases, making them impermeable to correct information because they are trained to filter off this kind of information. So, for example, junk science and conspiracy theories are, in this sense, the highest, the most dangerous form of disinformation. And of course, for example, systematically designed fake news simply follow at the top rank in terms of dangerousness. So we have developed, and my colleague Manlio Di Domenico tomorrow will illustrate you the technicalities, we have developed an index of infodemic risk. So it's not only about how much incorrect information is spread through the system, but what kind of incorrect information, how dangerous it is, how widely this is replicated through the system. And interestingly, we find that this index of infodemic risk gives us a first measure of the cognitive dimension here. And it's interesting to notice that there is no obvious relationship between the level of infodemic risk in a country in a certain moment and the level of socioeconomic development. So not necessarily the countries that sit at the top, for example, of the socioeconomic developmental statistics are at less risk of infodemics than, for example, less developed countries. So it's extremely interesting to look at the cultural geography of this particular distribution, and this is particularly important not only for the current pandemics, but more generally in terms of potential vulnerability of countries, of which, of course, the reasons have to be understood and investigated more deeply. Next, please. So, in terms of the socioeconomic factors that are behind the effectiveness of public health prescriptions, it's extremely important for us to understand that public health prescription can really be sensitive to the social economic dimension in very subtle ways. For example, in the case of lockdown and social distancing, that is today, of course, dominating prescription in most countries heavily affected by the epidemics. What is a critical factor that is often underplayed? It is the fact that in this moment, of course, staying at home or social distancing has completely different implications for people depending on their level of socio-economic status. So for people who live in comfortable homes or who have, of course, enough savings and stable work prospects, it's much easier to comply with the prescriptions. Very different for people who are, for example, in a precarious situation in terms of, for example, economic safety, or they have very conflictual and problematic family relations or difficult conditions at home, also in terms of dwelling and coexistence of physical coexistence of people. So, for example, if there is a widespread perception that people feel that there is a widespread socioeconomic inequality that is, of course, affecting differentially people, the willingness to comply could be much lower for people with lower socioeconomic conditions, and this can be extremely critical. So, for example, there is a very complex and tricky interplay between perception of social justice and effective public health measures. Or, for example, in Italy now, there's been a recent regulation in Lombardy, where I live, the region that has been most hardly hit by the epidemics in Italy. There is now a mandatory mask prescription for people going out. But the problem is that on one side, of course, these masks are not being made available in time, but also the fact that people now have mandatory mask rules could also mean that people go out more often because they feel safer, and this perception of safety could be absolutely misplaced. So again, it's extremely important to test this kind of prescriptions, both in terms of behavioral prescription and communications before they are actually implemented. But at the moment, there is basically a sort of amateurship in this. Every public health prescription from this point of view, even from public authorities, is simply issued without any specific evidence base that is supporting this. Next, please. So in terms of public policy implication, it's extremely important to design public health interventions through a data-driven approach that gives us a clear basis in terms of the emotional—
1 minute.
Thank you very much. In terms of the emotional and cognitive response, and so using this basis to support and design efficient measures. At the same time, the evidence-based approaches today are absolutely needed, and in this specific social behavioral dimension, they are basically lacking. So we need to develop protocols that are very similar to those for standard public health interventions, and this is basically still a completely uncharted territory. And to finish, computational social sciences, though, offer us very useful tools that are complementary to laboratory experiments to develop those protocols and test their effectiveness. And I think this is an extremely promising avenue, both from the research and policy design point of view. Thank you very much.